Welcome to our presentation on the impact of the DNP on nursing practice. The AACN originally developed the DNP program in response to the increasing number of curricular requirements throughout master's programs and sought to standardize the practice entry requirements for the APRN. Early programs were diverse in curriculum and teaching styles. Many critics felt the DNP programs were void of academic rigor, and the diversion of students from the PhD programs would impede research. Despite this criticism, DNP programs continue to expand. Contemporary opinions emphasize the importance to expand educational programs to establish parity with physicians and improve relationships. The 8 essential competencies established for the DNP by the AACN are compatible with the goals set forth by the Affordable Care Act, which are to improve care delivery systems, increase access, emphasize health education and prevention, and transition from a fee-for-service payment system to an accountable care system. This new practice environment requires new skills, knowledge, methods, and collaboration in order to respond sufficiently to new compensation and demand that the DNP-prepared nurse can provide. DNP programs have existed for over a decade, and confusion regarding the role and value of the DNP-prepared nurse still exists. The DNP was developed to prepare nursing professionals as advanced providers of care and leaders within the system. The aim of improving care quality and cost, in combination with the goals set forth by the ACA, provide an opportunity for DNPs to establish nursing as a full partner in making significant contributions impacting individual health and the overall wellness of the community. DNP-prepared nurses are assuming new roles to improve clinical practice, enhance credibility, and initiate practice innovations. DNP graduates bring an advanced understanding of clinical knowledge, healthcare systems, policies, finances, technology, and leadership to the primary care setting. 2 other practice settings, long-term care facilities and home health care, have shown benefits from DNP providers such as direct patient care on a daily basis and hospital readmission prevention. In the acute care setting, DNPs coordinate high-quality patient care by bridging the divide between research and practice. DNPs decrease morbidity and mortality resulting from errors and complications that arise during the transition of care from home to hospitals, subacute care facilities, or palliative care. The leadership and professional responsibilities of the APRN include collecting and evaluating DNP-educated nursing outcomes, implementing positive changes in healthcare, actively participating in professional involvement, educational advancement, encouraging interprofessional trust and collaboration between nurses and physicians, as well as promoting DNP professional awareness. Although DNP-educated nurses have demonstrated great value as advanced providers, further data needs to be collected to achieve a consensus on whether or not the DNP should constitute entry-level education for advanced practice nurses. Recent economic changes, the primary care provider shortage, and substantial cost of transitioning to DNP programs have contributed in the delay of mandating DNP education for APRNs. In the meantime, for students in master's APRN programs and currently practicing APRNs, DNP-prepared providers serve as excellent preceptors, mentors, and educators. Long-term, it may be beneficial for master's educated providers to pursue the doctorate degree to provide the best evidence-based care through a team-based, patient-centered, and comprehensive approach. The value of further education directly impacts individuals, populations, organizations, and communities. The DNP-prepared nurse secures roles in healthcare above that of the APRN, including administration, policy specialist, informatics and research with the goal of meeting patient needs in various settings.